Let's go to our 3D image, and we want to see what some of these common concerns are for these patients. When they come into the office, what are they looking at? What are we seeing happen to the face and the skin evolve over time?
So, when Tanya and I are assessing a patient who is coming in for aesthetic improvement of changes in the face, we basically divide the face into 3 zones: upper face, which is going to involve the eyelids, the eyebrows, the forehead, and the transition area between the lower eyelids and the cheeks. What we call the mid-face involves the cheeks and that transition area with the lower eyelids down to the jawline, and then the lower face is going to be the jawline and the neck. So, changes that we see, for example, we're talking about non-surgical and surgical options. At some point, there are changes that are non-surgical treatments are not going to improve adequately. And again, it's always about setting patient expectations. So the first thing we need to know is, what is the patient looking for? What outcome are they hoping for? If we can offer something that's non-surgical, that's usually going to be in the patient's primary interest. But sometimes those non-surgical options are just not going to get them where they want to be. So in the eyelids, for example, redundant skin in the upper eyelid that we perform a blepharoplasty for, there's not much non-surgical that we do for that. The bags and the puffiness from the bulging fat in the lower eyelids, that's a surgical treatment primarily. We can affect the transition between the lower eyelids, the tear trough, and the cheeks with injectable products, as we do with surgery. But sometimes if that's the patient's primary goal and what they want to improve, we can do that with the non-surgical options. So, it goes on and on. We'll talk a little bit more about that, about other parts of the face later on, I think. But that's the effect. When we're assessing the patient, we want to establish what their goals are and decide if we can do that non-surgically or if it requires surgery.